Another interesting thing, of course, is that stupid term that we call triaditis, because
let's go there.
and you know that, and I prefer to call it, concurrent inflammatory conditions of multiple abdominal organs, which of course nobody wants to call it.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Joerg Steiner, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. Hi.
See, now she's messing up again. So, all right. Hello, this is the Purr Podcast. This is Dr. Joerg Steiner and...
I'm Dr. Susan Little, I think.
Right. This is the second episode of the Purr Podcast with a very famous guest.
Yes.
Mm-hmm.
Yes.
And we talked a lot about how he became what he became. And then we left with a cliffhanger. Dr. Susan is going to reveal something.
Yes, so my plan is to ask the deep, hard, searching questions of our guest, Dr. Joerg Steiner, about feline pancreatitis.
Okay.
And I say that because as a feline clinician for a very long time, I become increasingly convinced that I don't know what chronic pancreatitis is.
Join the club.
Right. All right, and that was the Purr Podcast. Thank you very much, everybody. Right.
Shortest episode in history.
Yes, that was fast. So, okay, this is all you need to know, people. Next time we'll do a surgery topic. It takes a little longer. It's a little bit more fun,
We'll do surgery of the pancreas.
And we can cause some pancreatitis when doing surgery.
We always thought that, and maybe I was doing wrong by my surgery colleagues because it probably looks
really
that it's
true.
not very common.
Yeah.
No, you all know, of course, Gary Northworthy.
Yeah.
And Gary, for many years, has taken pancreatic biopsies.
Right.
And when he first told me how he does it, I was absolutely horrified. Because he takes a skin punch biopsy and he jams that thing into the pancreas. And so I said, I'm sure you're causing pancreatitis. And we did a study and he looked at 100 of those cats. And we did PLI tests every day from before he went in. And then, 3 days later, in one single cat had an elevation of PLI for 1 day.
And I could have told you that. And you know why?
You couldn't
Well,
say
that's
it.
because you're so much smarter than
No,
either of us.
it has nothing to do with smartness. But, surgeons are relatively stupid. So they don't think about consequences. They just do their little thing. And then if it survives, it's good. If it doesn't survive, it's not their fault. It's someone else's fault.
As long as you said it.
So that is, in short, the thing. So what they do with the pancreas horrifies me. So there is this technique, which is the crushing biopsy technique, where you
Okay, I used to do that.
Okay, so Dr. Susan, can I finish my
I'm not allowed to talk about surgery.
No, please don't. So then you take a piece of pancreas and you put a suture around it and you crush it. And
I call it the guillotine.
Right. And I mean, from all perspectives, that is probably the stupidest thing that you can do because it causes so much irritation, and you cram everything in there. And so if you cannot get pancreatitis from that...
But nobody ever showed that. Nobody ever
nobody looked at it. Oh, they did look at the different... So I think there's one study that did the fillet technique where you try to find a little, you fillet and then the crushing technique. And there was no difference between
technique.
Right, so there's no really difference between it. So the pancreas must not be that sensitive. That was what I was
exactly.
That's what you're getting at.
Right, and thank you, Dr. Susan.
And I just want to tell you now, for a long time, I do punch biopsies.
Yeah, and I mean, the pancreas is very resilient and it's kind of interesting.
Yeah, we do a lot of laparoscopic biopsy, so and we're not putting anything on there. We're just grabbing with the little right thing and you're done. And so
where did this idea that the pancreas is so sensitive come from?
Well,
because I was taught that.
Okay, and it makes sense if you think of it. If you stand back and just look at it and like, what can I did an insulinoma surgery so that I'll get pancreatitis. And in people, it was the same thing, except in people, then they found, okay, if I do open heart surgery, people get more pancreatitis.
Okay.
And when I do a leg amputation, people get pancreatitis. So
Oh.
maybe it's not the surgeon.
Ah.
And so that took a while, you know. But I mean, you know, sometimes, you know, I mean, think about steroids. For the longest time,
Yes.
there are some other species that we don't want to talk about
Yes.
that for the longest time was believed to have pancreatitis because of steroids. There are several papers out there, right?
Yeah.
And in people now, they have shown is that it's not the steroids, but it's actually the disease. Why they're getting steroids, that's the underlying cause. And so oftentimes we don't think it through.
Yeah.
Or we do try to think it through, but we're not doing a good job.
Yeah, so I was one of the people that started with the ligature on the pancreas, and you would think that that would cause a lot of pancreatitis too, because now you're burning the pancreas. So anything you can do with the pancreas, because it used to be that they said even if you you touch the pancreas, you get pancreatitis, which is absolute BS.
Yeah. But that is exactly how I was taught. You leave Mr. Pancreas alone.
And from a surgical perspective, I think that is nice because a lot of people don't do anything with the pancreas, so at least they don't muck it up.
No, but you can take a piece of it.
True.
Oh yeah, you can.
If you're honest, you know, that's not really a problem, you know, because it just shows that we're able to adapt. You know, Carl Osborne once said to his students that, you know, 50% of what I teach you today will be proven wrong tomorrow.
Right.
And as long as you embrace that, you know, you haven't eaten it with spoons, and the generation after you may prove you wrong, I have no problem with that.
No, I agree with you. We should be evolving.
Right.
We should be.
So let's go back to chronic pancreatitis because, of course, there's not a solid answer, and we're not going to stop the podcast. I promise you, we're going to talk about it. But where are we?
Well, we are. So there's many areas that are evolving in feline pancreatitis, and one of them is to look what the underlying cause is. You know, for example, in dogs, diet seems fairly simple, meaning you have a high-fat diet, you have a low-fat diet. Dogs with, I can't believe I said it, but, you know, canines, you know, you feed them a lot of fat, they get pancreatitis, you can treat them by doing. Cats, that's not so easy.
But they're adapted to a higher fat diet to start with.
True, but there is an impact of diet. I cannot tell you how many consults we get where a cat has been switched to a renal diet or a low-carb diet, and after 3 months they get pancreatitis, and you take them back off and they give it. In fact, my own first cat I ever owned, Hobbs was a terribly obese cat. He, you know, and he developed diabetes, and he developed. So I put him on a low carb diet, and his diabetes got better. He didn't need insulin anymore, but boy, he got pancreatitis. I'm not sure it's fat, but it could be higher calcium, it could be lower magnesium. I have no idea. That's what we're trying to determine. And so the first step is actually, and we're doing a study now, is to actually see, is it truly statistically true that when we switch cats to those diets, that they do get pancreatitis? It's a very hard study to do, but, you know, because you have to go back and ask lots of questions. But that's the first question. Is it not just my impression? Or am I completely wrong? I could be completely wrong.
I would never have thought that, so I could be completely wrong too. You know, you don't see what you're not looking for one thing, right? So could you think that could be a microbiome shift of some kind play into that?
You know, the microbiome has been very well studied in people with pancreatitis, and while you get dysbiosis, no question, with pancreatitis, adjusting the microbiome has been terribly unsuccessful. In fact, you know, the Dutch pancreatitis group has shown that more people die when you try to do that. So I'm not sure. There's, and as I said before, there's more questions in feline pancreatitis than there's answers at this point. So you basically just kind of chip away at all these different things. So we know that hypocalcemia can cause pancreatitis, but never anybody has described that in clinical patients. So now we need to, you know, but you can't do all these studies at the same time. You pick one study and then you answer that question. And I think, you know, we've done a fairly good job with the prednisolone and the cyclosporin story to show that cyclosporin is in fact superior. That whenever you do studies like that, like this one was not controlled, it was modestly controlled in the sense that we had a control group, but they weren't assigned randomly, because if I were to take 10 of my cat owners and say, half of them don't get any treatment.
Yeah.
And the other ones, get treatment. In Texas, I'd end up on a tree very quickly. Right. Not in a good way. It's a lot easier for me to criticize a study than to do a study.
Yes.
There is an autoimmune background there. We don't know exactly what it is because it makes sense. When you look at that difference between reactions between the two drugs. So something triggers this autoimmune
there has
response.
to be a trigger.
So and that fits more with your disease theory for me. So you have a disease somewhere. That disease causes an autoimmune response that then affects the pancreas. Is that what you're thinking, or what?
Most likely, because that the other interesting thing, of course, is that stupid term that we call pancreatitis, because of that.
Yeah, let's go there.
And and I prefer to call it concurrent inflammatory conditions of multiple abdominal organs, which of course nobody wants to call it. Clearly, when you have 3 organs, and sometimes even the kidney involved with nephritis, you have 4 organs that all have inflammation that's idiopathic. Boy, that looks autoimmune to me. So.
And I've used pancreatitis, of course, myself for many years, but now it makes it sound like it's its own thing and we know what it is.
Yes, exactly.
Yeah.
Well, and that, of course, there's pancreatitis in humans, which is something completely different. It's inflammation of the hepatic triad. And so you talk to a human physician, and they're like, my cat has pancreatitis, and they're like,
okay.
It wasn't the best of names. And the interesting thing, of course, is that humans get the same thing. Yeah. They get this concurrent inflammatory condition of multiple abdominal organs. They just don't call it pancreatitis.
How do they call it?
Well, they call it, concurrent inflammation.
Right.
Also, the centerpiece in humans is actually usually IBD. And then the pancreatic inflammation is secondary, and then maybe the liver is not as often involved. And so, they name it by the first disease, so to speak.
So let's go there. Could that be the same in the cats? Do you know if cats get IBD? Because cats, the one thing that I think is so interesting in cats is, for me, because that's what I'm interested in, is the differentiation between lymphoma and chronic irritation of the bowel, and we cannot really make a differentiation between them, which means to me it's probably chronic inflammation.
Yes.
And could that be linked to pancreatitis?
Oh, absolutely. Right. Clearly the pancreas is in the same neighborhood, and the blood supply is shared often, like a lot of it, and the neurologic connections between the intestines and the pancreas. It's all one thing, right? And so, there's no question that there is some relationship, but what that is exactly is the great big question. There could be hormones involved, for example. There could be, there's, the microbiome clearly is important. With the microbiome, it's a little bit more complex. You could link the liver and the intestines fairly easy because, you of course have external antigens, and so you have antigens from the microbiome coming into the liver. But the pancreas, it's different. It's not like all the blood from the intestines goes to the pancreas. It doesn't. Yeah. But all the blood from the intestines go to the liver. So those two are easier to connect, let me put it that way. Still with the pancreas, we have to acknowledge that there's hormone, the same local hormones, there's the same neurological systems that affect both.
But if the inflammatory component is in the blood and the liver doesn't take it out, it will come to the pancreas at a certain point.
At a certain point, but then, it would first go to the heart. So why is the heart not involved?
You don't know. Are you taking biopsy of the heart at the same time?
No, but, people have looked, have certainly done, when they do a complete necropsy, they take a piece of the heart. And so by now, somebody would have said, there's inflammation of the heart. Wonder where that's coming from. That's not happening.
So this is a podcast where a lot of veterinary professionals listen to, and they want to know what to do. So I want you to let me know if a cat has an acute pancreatitis, what is a good treatment protocol, for chronic too.
I think that's a very important point, is that acute and chronic are very, very different. And acute, of course, in cats, because we don't have a drug. I on the plane here, I read a paper about acute pancreatitis in humans, and evidence-based medical treatment. In the abstract, it said the most important thing was immediate modification of inflammation. That's fantastic. That's exactly what we do in this lesser species. because we have the new drug to do that. And then I got to the portion where they described the details, and the first sentence was, unfortunately, there is no drug to modulate inflammation.
You're sitting there.
And you're like, yay! Yes, there is.
There is for this lesser species, but so there is. It's not none for cats either, and so that's something that hopefully will change. At this point, we don't have that, so we're left with symptomatic and supportive care. And so what that means is, of course, we look for causes when we can. Again, diet, hypertriglyceridemia, not really a thing in cats. Actually, funny enough, on this meeting, somebody came up to me and said, "Oh, I have a cat that has triglycerides of 1,500 and has pancreatitis. So now we're taking samples from this cat because in my entire career, I've been able to find one cat so far. This is number 2. And so somehow that same connection doesn't exist like it does in humans.
Yeah.
Anyway, so going back to your question, so it's fluids, it's antiemetics, it's nutritional support, it's all of those kind of pain medications, but it's all supportive symptomatic.
Yeah.
Right.
There's no secret sauce for acute pancreatitis. But for chronic pancreatitis, I personally, and again, there's lots of different opinions, but I look at diet. And if they're on either a weight loss diet or a renal diet, I try to switch them because that seems to work often if I can.
Yeah.
You always can. You may not be able to do it with a commercial diet, but there is nutritionists who can calculate a diet that what you want to see. And when you do that, actually, then you can also look at magnesium and calcium, which is there's very nice rat studies that show that, if you have an elevated magnesium content in the diet, that you can actually, make pancreatitis better.
Right.
And we tried this in an animal study, and we just couldn't get as much magnesium into the animal that would have been effective.
As a longtime feline clinician, one of my frustrations, and I do this too, is we often talk about the disease, pancreatitis, whatever disease you want to mention, as if cats only ever get that one disease, right? We do a lot of one disease lectures, right? And of course, as you know, in my world, cats collect diseases. And so it's really common for patients in my hospitals that have chronic pancreatitis to also have other diseases that may or may not be related. The symptomatic and supportive care part is mostly easy. It's the nutrition part that's hard, right? So we often feel like, I often have to stand there and think, okay, which of the diseases is going to kill you first or be worse if we don't address.
Exactly.
So,
and I think that is where if you have acute pancreatitis, that's a very easy one.
Right.
Because the chronic kidney disease, the hypothyroidism goes way down the list in importance immediately.
Yeah.
Now with chronic pancreatitis, that's a little bit more complicated.
That is the complicated bit.
And that's where I like to have a nutritionist actually help me design a diet sometimes where you get something for both worlds. And now we wish we would know more about it, but then, once you've done that and you look for concurrent diseases, I always do that, that's very important. And then you also, of course, with cats very quickly, you get to the discussion is, that's all fantastic that I want to give 3 drugs for pancreatitis, 5 for the liver, and 2 more for whatever have you.
But you can.
And you can prescribe it. But you certainly don't going to make the cat take it.
No.
And that's why I always come back to diets, because if you can fix it with the diet, then it's already automatic.
Absolutely.
Right.
Yeah. I don't think we're aware enough of the difference between, as you say, prescribing it and then what happens at home, right? So my husband and I are both veterinarians, and years ago we had a cat with diabetes, chronic pancreatitis, and IBD, right? And so there's a list of drugs. And we're both veterinarians, and we struggled mightily. And that was such an eye-opener for me, right? So it's made me try to edit down the list or at least prioritize them.
Exactly. That's what you need to do. And every owner is different, and every cat is different, right? There's cats that sit there.
Yep.
But most cats do not, let's just face it. And most owners don't have an hour every morning and every night to do all of this. And they have, 10 seconds between running the kids to school and, going to work. Yeah. So, you need to have a realistic discussion, and you need to make sure the owner understands which one of these medications is your number one choice. Oops, sorry.
Oh, is it?
I'm on consult calls this week, believe it or not.
Okay, well, we can.
Anyway,
we can just take the call.
Yeah.
Yeah, that would be good.
That would be interesting.
It's like we have a question from the audience.
We'll do a live
question. That's it. Because I just want to tell the audience that you made a facial expression that they can't see, but if they go to our YouTube channel, they could. But then we get a live question from the audience because they're listening right now. So. Great.
Anyway, so those are really important considerations. We need to sometimes get a reality check.
Absolutely.
And so, but anyway, just to finish the question you asked me before. So in chronic pancreatitis, certainly diet is one I will consider.
Right.
But then very quickly I get to the point where I said I cannot help you anymore, and that's when I then say, okay, let's do a steroid or cyclosporin trial.
Right.
And in cats now, it's really, I very heavily push the cyclosporin because it also has a lesser impact on diabetes. And as you know, most of these cats have concurrent diabetes. Some people then say to me, well, but we don't really know whether it works right. We don't, we have done a study, but we haven't proven the final thing. But the truth is I have nothing else to offer.
No,
you.
exactly.
And so how long and how much are you getting?
So what I do is what I recommend doing is that they start on 5 milligram per kilogram twice a day. And they do that for about 2 to 3 weeks. And in 2 to 3 weeks, I have a discussion with the owner, because oftentimes with pancreatitis, especially milder cases, the animal will change. Where before we didn't think that this was actually, let's say the cat is getting older and it's getting a little less playful, and we think it's the cat's getting older when in fact it's the abdominal pain that's making it.
Right.
And so that's why this discussion with the owner, has anything changed in your cat? Does it eat better? Does it, play better? Is it more interactive? Does it pee less on the floor?
And so that also means to me that you don't have a really good marker to show progress.
No, I do. I do both of that. So then I measure pancreatic lipase.
Right.
But I combine the two.
Yeah.
And if both of them are negative, then I say I'm going to stop again, and there's nothing else I can do.
Right.
If one of them is, even just one of them is positive, either the PLI dropping or the clinical signs improving, I would tell this owner I would go on.
And you're going to stay at the 5?
I try to then drop it down. To once a day and every other day.
Nice.
But that's a whole different story. How far we can drop it.
Right.
So are you happy with the marker, or do you want to make a better one?
I'm very happy with the marker, but we need additional markers. Think about the liver. That may be an easier concept to think about. I don't have to explain to you for more than 10 seconds that if I look at liver disease, I want one for inflammation, I want one for function, I want one for fibrosis. That's exactly the same in the pancreas. I want one for severity. So I'm very happy with pancreatic lipase as a marker. There's something wrong in the pancreas.
Right.
Great marker, very sensitive. I don't have a marker for pancreatic fibrosis. I have a marker for pancreatic function, but only if it's really, really bad.
Sure.
The question you're asking is not the right question. Do I want a better marker? No, I want many more markers that zero in, that give me more information. In 20 years, hopefully we have a panel of markers that's gonna, it's the pancreas panel.
Do they have that in humans already?
Very, very, very limited. They use markers, for example, for infectious complications, so calcitonin 2, but there's no panel. But the big difference between people and cats is that in people, they don't blink an eye to do a computer tomography of the abdomen.
Yes.
And so they have seen this whole shift in improvement of CT that we have not seen in veterinary medicine. So, they now, it's a 97% sensitive, 95% specific. Well, you don't need another marker.
Right.
So they do lipase, and actually they use even 1,2-diglyceride lipase in many hospitals, because the truth is, if it's elevated, they shove you through the CT scanner. And so
why don't you?
Well, 3 reasons. Number one, we have not done the research.
Right.
So if you look at any of the cat studies, the 2 cat studies that are out that reported sensitivity of 20%. That's not very good.
No.
Now, granted, that study was done 20 years ago, and maybe with current equipment would be far better. We don't have the data. Number one. Number two is that a CT costs you in veterinary medicine, depending where you do it, $800, $1,200. Do you really want to spend it on a single diagnostic tool that may not give you the final answer,
And which may not change your treatment.
Exactly. And then the price is that you have 1 or 2 days less in the hospital. And pancreatitis, at least acute, is very, vacillates a lot. One day it's better, one day it's worse. It's not uncommon for humans to be in the hospital for 6 months with pancreatitis.
Oh,
wow. Which is also funny because people ask me, well, why do cats and dogs, not die of infectious complications?
Mm-hmm.
It's because they don't stay alive long enough. Because in humans, that happens after 6 to 8 weeks in the intensive care unit. Well, have you ever seen a dog that is in intensive or cat with the intensive care unit for 6 to 8 weeks? I haven't. Right? I mean, our owners would, after a week, would say, sorry, I just cannot afford this anymore. And so this whole spectrum of disease that they see in humans, we don't see in cats.
Because they don't live long enough.
We don't let them live long enough.
Yeah.
We may see it.
Oh my gosh.
Those are all things that we need to consider. And so that to me makes it very painful to use a diagnostic tool that's $1,200 that then makes me tell the owner, we've spent $5,000. Do you have money for another 2 days? So I think those are the 3 reasons why CT, number 1, is not where it is in humans. And number 2, why it's probably not going to get there very quickly.
Mm-hmm. It's not that commonly available either.
Exactly. A serum diagnostic tool you can send out.
Yeah. Although I do think that most bigger practices, at least in North America, will have a CT. I mean, it's pretty much...
Well, it depends when you talk about bigger practices.
And I would probably divide Canada versus the US there a bit too,
It's too cold there.
Yeah, it's too cold to run
They don't
them.
function as well.
Yeah, they don't run in the winter.
And then the last thing is think about this. The pancreas in a human is like this, right?
Yeah.
The pancreas
in
in
a
a cat is like this.
that.
And what is CT? It's slices of radiographs.
Mm-hmm.
When you think about taking slices of radiographs of
of something that's that tiny.
So there's multiple reasons why I don't think we're going to wake up tomorrow and find that all of a sudden that's the
So even in humans, it
choice.
has not been replaced by MR?
No. In humans, because CT is so good that MR is, there are some centers who do more MRI, but most of them don't do MRI. And MRI certainly, in Colorado State, they've shown that the complications of pancreatitis, like the microthrombotic disease, that is much easier diagnosed with MRI.
Right.
But that's the end of it, meaning there's no other studies that have shown that overall it's a great diagnostic tool.
This has been wonderful. We're at the end again. So, so much information, I have to say. That
I know.
This has been a great episode. Thank you, Joerg.
Thank you for having me.
Yes, thank you. And at least I feel like I'm still doing okay, saying I don't know what this disease is and I'm just treated symptomatically, right?
You're always doing okay if you don't do surgery. So that is the general conclusion, and that's, I appreciate that. Thank you.
I'm sure you do. Yeah, surgeons everywhere appreciate that fact.
Yes.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.